Imagine waking up in the morning and realizing you're unable to walk. You can't move your legs. Trying to pick up your phone and your hands won't stop shaking. Trying to talk and find yourself catching your words, struggling to make them come out right. Scared, you rush to the hospital where the doctors run many different tests: brain scan, blood test, neurological exam, MRI, and of course, those takes weeks, if not months, to complete. Few months after, you get a call from the doctor to give you the great news. There is nothing wrong with your brain or with your body. Then you start questioning yourself. How can everything be okay when I can't walk? How can everything be okay when I can't talk? How can everything be okay when my body doesn't feel okay? How can everything be okay when the pain in my body is real? What you might be experiencing is something called functional neurological disorder, or FND, a condition where the brain has trouble sending and receive the right signals to the body, which causes very real and disabling symptoms, even though nothing appears damaged in scans or tests. I became interested in this topic after seeing someone close to me go through it right in my own home. Watching how much their life changed and how difficult it was to find answers made me want to learn more and bring awareness to others about functional neurological disorder. Today, I'm going to talk about what functional neurological disorder is and the symptoms people may experience, some possible causes, and the treatment and management strategies that can help people live better with this condition. Functional neurological disorder is a condition that affects how the brain and the body communicate. It impacts how the brain sends and receives signals, even though there is no structural damage in the brain. This means that people with functional neurological disorder can have real disabling symptoms even when medical tests appear normal. The symptoms can vary from person to person, and they may include weakness, tremors, non-epilepsy seizures, problems with the vision, problems with the speech and movement. According to the National Institute of Neurological Disorder and Stroke, functional neurological disorder is a problem with how the nerve system functions and not with structure of your brain. They explain that people with functional neurological disorder experience real symptoms such as tremors, loss of coordination, or blackout. For example, a person with functional neurological disorder may suddenly lose the ability to walk. They might be walking right now, 5 seconds, they're unable to walk. Even though medical scans show no brain injury. This happens because the brain is not sending the right signals to the body and not because of physical damage. Researchers believe functional neurological disorder may develop when the brain's normal process of movement, sensation, and perception become disrupted. It's not caused by intentional actions or faking. Sometimes it can be triggered by stress, physical injury, or illness. The American Psychological Association notes that functional neurological disorder can sometimes follow a physical injury or emotional stressful event, which may rewire how the brain processes signals. For example, some people who experience a car accident may later develop functional neurological disorder with the symptoms like leg tremors, leg weakness, even when their body has fully healed. While there is no single cure for FND, there are effective treatments that can help people manage their symptoms and improve their quality of life. Physical therapy, occupational therapy, and psychological support are often part of the treatment. Education about the condition is also key, as understanding that symptoms are real and functional can help reduce fear and stigma. According to the National Health Service, multidisciplinary care, meaning treatment that includes physical therapy, mental health support, and education, has been shown to improve outcomes for people with FND or functional neurological disorder. Over the past few minutes, I have talked to you about what functional neurological disorder is and symptoms people may experience, some of possible causes, and the treatment and management strategy that can help. Functional neurological disorder is a condition that reminds us how powerful and complicated the connection between the brain and the body really is. It can make simple tasks like walking, drinking a cup of water feel impossible, and yet medical scans often show nothing wrong. But just because something can't be seen doesn't mean it's not real. There is still so much we are learning about functional neurological disorder, but awareness and understanding can make a huge difference for those living with this condition. So next time you see someone struggling with invisible symptoms, remember that a little compassion can go a long way, because for them, that understanding might mean everything. Thank you.